All right, we've recently talked about neck trauma. Yesterday we talked about chest trauma. It only makes sense that we make our way down to the belly, talk about abdominal trauma. So again, all trauma, let's break this down into penetrating and blunt. So penetrating injuries to the abdomen or eviscerations, so meaning literally somebody comes in and they have intestine hanging out, would require immediate exploration, okay? So these patients, we are going to explore most of these, and that entails what we call an exploratory laparotomy, meaning we make a midline laparotomy incision, we look inside the abdomen and see what's going on. So that would be a GSW to the abdomen, a stab wound to the abdomen, or again, something that causes an evisceration where the intra-abdominal contents are literally herniating out of the abdominal wall. Those are going to require immediate exploration with, like I said, an XLAP is what we call it. Exploratory laparotomy. Okay. Now, blunt trauma, much more common and a little bit more nuanced. So let's talk about it. So a patient comes in, they have, say, a seatbelt sign. They were in a high-speed motor vehicle crash. They have a seatbelt injury to their lower abdomen. Now, their hemodynamic stability is going to be number one always, right? So vital signs are most important. So are they hemodynamically stable or unstable? Okay. And then on top of that, it's going to be our FAST exam, our focused abdominal sonography for trauma. So patient comes in, blunt injury to the abdomen. They are hemodynamically unstable and they have a positive FAST exam. Guess what? We're going to the operating room, okay? So again, blunt abdominal trauma, we're worried about the solid organs, the liver, the spleen, the pancreas, and the retroperitoneum. And then we're also worried about a hollow viscous or intestinal injury. So whether that's your small intestine or your large intestine being the colon, and then also bladder injuries are another one. Bladder injury is tricky because you could have a positive FAST and the patient could be rock solid stable. And then you end up finding an intraperitoneal bladder injury. But that's abdominal trauma in a nutshell.